Okay, good morning everybody. All right, today I can report that we have 3 new cases in Queensland. All 3 are linked to the academy, the Corrections Academy. So we have 2 new cases of people living on the Gold Coast at Pimpama and 1 new case at Forest Lake. This takes our active cases to 20. Our total confirmed cases now is 1,113, and the number of tests in the past 24 hours has been 21,653, which is amazing. So I still want to stress to everyone, it's absolutely very important that if you have any symptoms, please go and get tested. And it's perfect time over the weekend if you are a little bit concerned. Please go and get tested, because what Dr. Young will also mention to you is that in these cases the symptoms have been very mild in people. So we don't want to have virus being circulated out in our community, so it's very, very important that if you have any mild symptoms, please go and get tested over the weekend. I can also confirm, we said yesterday from the trainer, the recruits and his associates, we had 25 people to be tested. In good news, they have all come back negative. But what we're doing is we're actually testing all of the 200 people now linked to that Corrections Services Academy. So we'll be updating you over the weekend about the results of those tests. Because we now have a couple of people who have tested positive to COVID on the Gold Coast, we are going to be taking some further immediate actions, and Dr. Young will explain these in further details. But coming into effect from 8 a.m. Saturday, we are going to extend those limits of people inside your homes to 10 people, and those gatherings outside to 10 on the Gold Coast, and the same restrictions we put in place for aged care, for hospitals and disability service providers will also cover the Gold Coast as well. We have to take this cautionary approach. I think everyone would agree. We acted very swiftly when it came to those earlier cases with the Brisbane Youth Detention Centre, and we know that people travel a lot from the Gold Coast to Brisbane, so now it makes absolutely perfect sense to extend that. So Dr. Young will go into further details about that. I also just want to address the issue of schoolies. Now, of course, we know we are in a different time at the moment, and of course the world's going through a global pandemic and things aren't as they would normally be. And can I first of all commend all of our teachers out there, the students, and the fact that we actually have people attending our schools in Queensland. There has not been those huge disruptions to classroom education that we have seen in Victoria and we have seen in other parts of the world. And of course, I think there are even comments being made about in Europe at the moment, there are concerns about schools going back with large outbreaks of coronavirus in countries such as France overnight. So what I want to say to everyone is I want to thank everyone for the way in which our schools have been open and the way in that the whole education system has responded. So we've had to look at this issue very seriously and from a cross-agency perspective, but fundamentally, as Queenslanders know, we always listen to the health advice, and the Chief Health Officer has deemed the event of Schoolies, it is a mass event over multiple days, is high risk. So the Schoolies that we have come to know over the years will not be able to go ahead in that form this year. This is a very tough decision, but it is also a decision that Dr. Young will talk about, has been also discussed at AHPPC about mass events that are held across the country. So not just Queensland, across the country. And this is a mass event. It poses high risk. It's high risk to not only the people that attend, all of the young people, but also the people they come in contact with, and of course their families and their friends and their grandparents. So we've had to take that very tough decision. So there will be, unfortunately, no concerts, no organised events, because there can be no mass gatherings. Look, I've had a couple of detailed conversations with the Mayor of the Gold Coast, Tom Tate. He fully supports the advice from the Chief Health Officer, and I thank him for that. And I hope parents can understand and students can understand that this event cannot go ahead in this format this year. So we will be, the Chief Health Officer and the Director General of Education will be writing out to all of the schools to inform the schools, and the Chief Health Officer and the Director General of Tourism will be writing out to all accommodation providers. However, we also know that our tourism sector does need support. So just as any other person can go along and book accommodation, people are welcome to continue to do that in those small groups right across Queensland. And families will be looking at booking their accommodation, and there is nothing wrong with small groups of people finishing school booking somewhere close to where they live as well, because as long as they actually abide by those rules and regulations that are set in place for hotel accommodation, then there is nothing to worry about. But it's a tough year for everyone, and hopefully things will get better by the end of next year, and we can have a double celebration. But we are in a world pandemic, and I just hope everyone understands that. I know that Minister Di Farmer and Minister Grace will also be talking to young people about other ways in which they can commemorate the fact that they have actually finished Year 12, and they'll be talking to young people about some other options and ideas around that. It has been a tough year for everybody, and I thank all of the Year 12s for the work that, the struggle really that they've had to go through this year with school being closed and then open. But we've had to make these decisions because it is about the health of everyone. So I hope everyone accepts that difficult decision, but it is the right decision, and it is absolutely based on the best health advice that we can give you at this time. So I'll hand over to the Deputy Premier and then Dr Young. Thanks, DP.
Thank you, Premier. So this is 3 additional positive cases related to the Corrections Training Academy, bringing to 15 the total number related to the clusters thought to be related between the Brisbane Youth Detention Centre and the Corrections Training Academy. It leaves us with 20 active cases in Queensland out of a total of 1,113 so far. They are all in their 30s, 2 from Pimpama, trainees at the Academy, and a 3rd from Forest Lake. As the Premier mentioned, we had another fantastic testing result, 21,653 tests, which is really, really great. It is putting a lot of pressure on our labs though, and the turnaround time for testing in our public labs is now just over 40 hours. And so I just urge people to be patient and understand that our lab staff are working around the clock, literally 24 hours a day, trying to turn those tests around as quickly as possible. These are, of course, the first confirmed cases of community transmission on the Gold Coast. They weren't in quarantine, and so it is necessary for us to extend the restrictions currently in place across Metro North, Metro South and West Moreton to the Gold Coast. That means immediately the Chief Health Officer will be writing to aged care facilities and hospitals to extend the restrictions in place there, and then commencing at 8 a.m. tomorrow, that limit on gatherings without COVID-safe plans of 10 will come into effect on the Gold Coast. Like most things this year have been different to other years, and Schoolies is no different, will be no different. The Chief Health Officer and her Chief Health Officer colleagues have considered Schoolies a high-risk event. That means that organised events will be cancelled, gathering limits will apply. Gathering limits will apply to beaches, to streets, to apartments. Apartment complexes will be required to keep registers of guests to allow for contact tracing. I know that means that a lot of young people will have been looking forward to a Schoolies festival like other young people have had the chance to have, but like everything else this year, Schoolies will be very, very different. It's important, though, I think, to put the couple of pieces of negative news that we report each day into a global context, because where we are is very, very different to where other places in the world that weren't able to get in control of the virus. France reported overnight 6,111 new cases of coronavirus, the highest number since they exited lockdown, but the second highest number of the entire pandemic, suggesting that they are currently heading towards a second wave greater than their first. The UK now reports 41,477 deaths. The USA just tipped over 180,000 deaths. And so while understandably we are focused on what's happening in Queensland and what's happening in the southern states, we should also acknowledge that the steps we have taken, difficult as they may have been, have saved tens of thousands of lives.
So we have 3 new cases of COVID-19 in Queensland from overnight, and all 3 cases are linked to the Corrections Training Centre at Wacol. 2 of those people live in the Gold Coast, 1 of those people lives in Forest Lake. So because of that, we now need to extend the restrictions that are currently in place for all of Brisbane, Ipswich, Logan, all of those areas. We need to extend them all the way down to the Gold Coast. The reason being is that all of these cases we have seen related to the Corrections Training Centre have been in younger people who've had, fortunately for them, of course, very mild symptoms, extremely mild symptoms. And I'm not quite sure of how it's spread within that centre, who's the primary case because of the mild nature of symptoms. We're just working that through at the moment, but clearly we do have those linked cases and we do have those 2 people who live down the Gold Coast. So to protect the most vulnerable, which is our elderly citizens, that's why we need to bring in those restrictions for aged care. Then to protect the people going into our hospitals, we need to bring in that requirement for that additional enhanced use of personal protective equipment in all of our facilities. Plus, we need to look at visitors going in and out of areas where there are more vulnerable people, disability accommodation services and so forth. So all of that will be happening and it will be in place for 8 o'clock tomorrow morning. So people can maintain their parties, their arrangements that they have organised for tonight, but because I know all those plans would of course be in place, but from 8 o'clock tomorrow morning, gatherings are limited to 10 in your own home, or if you're out in public and it's a non-organised gathering, wherever we've got COVID-safe plans. So that includes for weddings and for funerals and for restaurants, pubs, clubs, clubs, wherever there's a COVID-safe plan, those arrangements can continue because of all the work that's been put in place by all those industry groups, by all of the people involved. They are very good plans. They keep people safe. But we know that in people's own home, no one would expect them to have a COVID-safe plan for a gathering, which is why they are now limited to 10. So it's all of Brisbane going down to the Gold Coast. Now, we don't need to extend it at this point of time beyond those areas to, for instance, the Sunshine Coast, further up the coast, because we don't have cases there, but they have all been restricted to that gathering limit of 30. And of course, if we were to have cases, then we'd also bring in the gathering of 10. But we don't. So this is about Brisbane, Logan, all the way down to the Gold Coast and Ipswich, and that's very important. And that also then, you can see that we've had to make a really tough decision about Schoolies. I personally feel for this group. They've had a really difficult year. This is a rite of passage. Your last year of school is such an important year to get you prepared for going out and joining adulthood, if I can put it like that. It is such an important year, and so much of it has had to change for this group. And I'm really sorry that they won't be able to have the traditional Schoolie celebration. But look, I think this group is one of the most resilient, innovative groups, and I'm looking forward to seeing what they'll put in place instead of that traditional mass gatherings on the beaches and so forth. They'll find other ways to celebrate. I know they will. And I think they'll happen over a longer period, because also this is a group that often has a gap year, goes away, does different things. They can't do those things, so they'll be around for over that Christmas, New Year into next year for longer. So I expect to see that the celebrations will continue over a longer period, and we're working with the accommodation providers to see how they might be able to facilitate that, so that they'll be celebrating in smaller groups, celebrating with their immediate friendship cohorts of groups of 10 coming together to celebrate. So there'll still be celebrations, I'm sure of it, there should be, but they'll just be completely different. Where now, I was just reflecting, I first heard about this virus in the first week of January. We're almost the first week of September. That's 8 months. We've all been living with this, and people in Queensland have lived with it particularly effectively. When we see what we can do today, as you heard from the Deputy Premier, what's happening in the rest of the world, we need to take advantage of that. We need to continue to be safe and to maintain all of our social distancing, but also look at what we can do within those restrictions, because there is so much we can do. It's really, really important that we just work that through and keep each other, ourselves, and everyone else safe. So again, the most important thing, these symptoms for some people, particularly younger people, can be exceptionally mild. We know that. We've known that now for quite a while. So if you've got any symptoms, and particularly if you live anywhere in the southeast corner with any symptoms, please get yourself tested and isolate yourself, because it could well be COVID-19. It's highly unlikely to be the flu, for instance. We've got so little flu in Queensland today. We have more COVID-19 than we have flu in Queensland at this point in time. So please, any symptoms, get yourself tested. Whatever you do, don't soldier on. Don't. I know Queenslanders are such hard-working people, and they keep going to work because they don't want to let down their mates. This time, staying home will be what you're doing to support your colleagues at work. So please, get yourself tested and stay home and wait for the result. Any symptoms at all. Maintain social distancing, follow those COVID-safe plans. They've been extremely well considered, well thought through. They will keep people safe. And leave your contact details wherever you go so we can immediately contact you. Because what if you were planning to go and see your grandmother and you gave your grandmother COVID when we know you've been in contact with someone with COVID-19. So that's really important. The more people we can get to download that app, the better. Thank you.
Thank you, Premier. Premier, thank you, and thank you for the opportunity to speak to you with respect to events that are currently unfolding at Queensland Corrective Services Academy. When I came before yesterday, I briefed you on the fact that we'd had a positive case, a senior and experienced trainer at the QCS Academy that had tested positive for COVID-19, and I indicated to you that we're working with Queensland Health to identify the primary points of contact at the Academy, a group of 14 recruits and a group of 11 colleague trainers at the Academy that we believed posed the greatest risk of infection. What I can tell you that those cadre of 25 have now been tested, and all of those have come back negative. But as part of the work that we've done in consort with Queensland Health to exercise a degree of abundant caution, we've now expanded the testing to include a broader range of people, including recruits and other trainers. And as part of that process, we've identified one group at the academy, a group of recruits, a group of 19. We've tested all of those people. Consequently, we've received 2 positive tests from that group. Of those 2 positive tests, we can identify that one of those people that have tested positive is a 33-year-old female recruit. That recruit lives at Pimpamar. There's also a 37-year-old male recruit also living at the same suburb, and they have had particularly close working relationship, having regard for the fact that as they live in the same area, they carpool together. That is their normal custom and practice, and so both of those recruits have tested positive. Of that group of 19, 6 have tested negative for the moment, and we're still waiting for the results of the other tests. But all of the people, whether they be staff or whether they be recruits, whether they have come to the academy for a course or any contact, including contractors or what have you, other people that might work there, are all the subject of testing currently. What we have also ascertained is that there is a further person, a 4th case, that has only recently come to light, certainly to my mind in the last half hour or so. This individual is a 33-year-old male. We know that he was at the academy and we know that he attended a course, and we're now making urgent inquiries with respect to others that he may have been in contact with. So this is a great degree of priority for us. We're working very consistently, very thoughtfully with Queensland Health in terms of everything that we're doing in terms of the testing regime, and I'm incredibly confident that we're doing all that we can currently to get to the bottom of this current outbreak. I mentioned to you yesterday that corrective services facilities across the state are at stage 4, and I mentioned to you the stringent requirements associated with the stage 4 limitations. All of these apply to the 14 correctional facilities from Rockhampton and including Rockhampton South. And what that means effectively is that there is no personal visits, professional visits, or any other visitations from outside sources into the corrective services facilities in those areas. It also means that our staff are wearing appropriately PPE in accordance with the advice from Queensland Health, and also we're making sure that we're limiting access within the corrective services facility from units and yards and facilities one to the other. It also means, unfortunately, that the prisoner cadre, bearing in mind that that's some 7,000 prisoners across Queensland, as a subset of 9,000 prisoners in total, are currently being locked away in their cell to isolate them from other prisoners and isolate them from staff to prevent any risk of transmission. This is an important and necessary step, and of course you could appreciate that this is the last thing that I would want to do. But it's incredibly important in the current environment. We're dealing with a very difficult, unique situation, and it requires difficult and unique response. We have a really dedicated, thoughtful plan guided by the best evidence and the science, and that evidence and science comes from Queensland Health. And all that we're doing currently in terms of our policy and our process is guided by that important work. And I want to thank the workforce that, I want to thank the workforce that I have responsibility for, the 6,500 staff that are doing a really good job in a really difficult set of circumstances, and again, reinforcing the Chief Health Officer's advice and the advice that I regularly communicate to our staff to make sure that they don't come to work if they're feeling unwell, if they're presenting with flu-like symptoms, they get themselves tested, and that they work with us in every step of the way to make sure that our corrective services facilities are safe for themselves and their colleagues, and safe for the prisoner population. There's a lot at stake. They're doing a great job, and I want to thank them for the work that they're doing. Thank you.
Good morning. So in the last 24 hours, we saw 60 domestic flights come into Queensland. 2,169 passengers were processed. We refused 12 persons entry. At our roads, we intercepted 3,273 vehicles, turned around 109 persons, and 276 persons were placed into quarantine. Regrettably, we're still seeing people doing the wrong thing, and over the last couple of days we've issued a penalty infringement notice for a worker and a massage parlour on the Gold Coast for not abiding by the COVID-safe plan. We unfortunately saw a male person at a hotel quarantine on the Gold Coast attempt to leave unlawfully. That person was stopped by our partner agencies helping us, including the ADF. He became aggressive. Police had to intervene. He was arrested and placed before the court and appeared at Southport yesterday and was fined $3,000 and now is back in quarantine. So the message there, of course, is if you're in quarantine, you need to complete it. Also, unfortunately, we saw a heavy vehicle stopped at the M1 vehicle control point yesterday where that person had a false declaration and was fined $4,000 and turned around. I'll just say very quickly that the investigation into the Lady Pamela continues. That is a little complicated. We're having to work with Maritime Safety Queensland and also the New South Wales Police Force because we're looking at not only the actions of that vessel and its occupants in Queensland, but also in New South Wales. And I'll just finish off by saying, with respect to Schoolies, as we've heard, that is a different posture this year. People need to understand also that we will still increase policing presence for that period. Gold Coast is always busy at that end of that time of the year. We'll have an increased policing presence on the Gold Coast for that period, and in addition to our normal policing, we will be very strongly focusing on the Chief Health Officer's directions and making sure that people are compliant with them. Thank you. Sorry?
I'm totally confused by this latest cases at the academy. We were told there were 3, now we're told there were 4.
Oh yeah, there was the original one and 3 more. So we had 1 yesterday that I told people about, and now we've got 3 more on top of it, so 4 in total. 2 live in Pimpama, 1 in Forest Lake, which is the 4th one, yes. We're getting all the details, but we understand, because I only got that one literally just minutes before coming up here for this press conference, so I'm getting all the details. But at this stage, I understand he attended one of the courses at the centre. And then the other 2 were in the dining room. So they weren't part of, so as the Commissioner went through in great detail, there were initially 25 people that I was particularly concerned about who'd had close contact with that original person who was positive. All of those have tested negative. Remember now, they've got 14 days quarantine from when they last had contact, but their first tests came back negative. Then we did go out broader and go through the entire centre and started testing more people, just because we weren't quite sure where the first person actually contracted the infection, so we wanted to do much broader testing, and we've got out of that 2 people who did attend the centre and went to the dining room. So they've been at the centre. And then the other one I just got this morning, who hadn't been in the dining room, but had been on a course.
So we don't know whether the first one from that first group of 25 is actually carrying.
No, you're absolutely right, yes. So we now have 4 cases in the centre, and we've now got to work through when each case first got symptoms, so who gave it to whom. I think that the 2 new cases got it from someone. I don't think they gave it to each other. They've got it from someone else. And I suspect the original case from yesterday might have also got it from someone. So there's a lot of work to go through here. But the good news is that it's at this stage, we haven't seen any other cases out in the community, so it looks like it's all confined to people within that centre.
Do you have new places in the community where these 3 may have been?
No. But of course we're doing that today. So as I said, I only just found out about the 4th one. The 2 before that I found out last night, so they started talking to them last night to find out where they've been. But given they live in the Gold Coast, and given that I understand they've had symptoms for a little while, I am concerned about where they've been in the Gold Coast, which is why I think we need to immediately put those restrictions, additional restrictions on the Gold Coast, no different to those that we have in Brisbane.
Have you currently said that these were the first confirmed cases of community transmission on the Gold Coast? Is that true if we know they might have gotten it from the prison? Is it community transmission?
It's community transmission, but they've got it in the centre. I'm pretty sure they got it in the centre, but it is community transmission, and they've been out in the community. So there's a real risk that they've spread it in the Gold Coast, yes.
Do you consider this to be a second wave, or because we haven't had a large community transmission not yet?
Well, we've got 20 active cases, so I don't consider it a second wave. When you hear that other countries are getting 6,000 cases a day, that's a second wave. This is not. And if you look at Victoria, how many cases they were getting a day, up to 700 a day. So no, but this is concerning. It is an outbreak, but it is one outbreak. It is one outbreak in the this centre, and then we've had another outbreak in the youth detention centre, and we're still looking to see whether there are links between those two centres. Oh, that's very, very sad, yes.
Did the woman or her doctor ask Queensland Health for it?
I can't go into specifics. Of course I can't. I mean, this is private for them at a time of grief. But what I can say is that you can go online, you can look at the direction, and in the direction it very clearly says that anyone can come across the border in an emergency. So the police do not stop ambulances, they do not stop life flight helicopters. Queensland provides emergency services to the northern part of New South Wales, and none of that has changed during this pandemic. Absolutely none of it.
That was the case when she did that?
It has never changed. From the 1st of January till now, we have continued to provide all of the emergency services that we have provided for decades to northern New South Wales. None of that has changed.
So that she would not have required an exemption?
I'm saying that.
Dr. Young, the opposition said that this process needs to be more compassionate and consistent, not have one rule for the rich and another rule for everyday Australians. What do you make of those comments?
I believe I am a compassionate person, and at this point in time, but we are working through the process, all of these exemptions come to me and I work through them. That's not sustainable because we are getting so many requests now. We are getting very large numbers of requests, particularly from Victorians who want to come up to Queensland because they don't want to remain in lockdown. So.
Figure on how many exemptions have been, how many people have applied for exemptions and how many have been granted?
Yes, we do have those figures, and very, very few people have been granted exemptions. The reason being, can I just explain to people that our hotels here in Queensland are managed jointly by health and police. We have health support at every single one of our hotels in Queensland. That doesn't happen in other states. So we can provide all of the support that is needed in these facilities for anyone, and that is where we need people to be. That is what has kept Queenslanders safe, by putting people in quarantine who are at risk of getting this infection, and we'll continue to do that.
That is right, that anyone needing medical attention urgently across the border, not ask for an exemption, waiting through. That flies in the face of the Premier's comment that Queensland hospitals are for Queensland.
Yeah. So if you need new care, right, you've got a new issue and you need new care for that, then it makes absolute sense. We've never done this before. Our hospitals have been open to everyone. But if you need new care, you don't have a relationship with anyone in Queensland, it makes sense to go somewhere in New South Wales. New South Wales has got very, very good hospitals and healthcare. Ours are excellent, of course they are. But they've got them, so people can go locally. And I actually genuinely believe, and we do this in Queensland, that whenever possible, you should get care close to where you live. You shouldn't be travelling for hours to get care. So this applies to people who live in New South Wales. But for those people who are in the middle of their cancer treatment, in the middle of their obstetric care, of course, they're being given exemptions to continue that care in Queensland. I have not denied a single one. But for those people wanting to come to Queensland for the first time for care, I am questioning, I'm not denying, but I am questioning, why can't you get this care in New South Wales? So that's where that work is happening.
Premier, can we get you on this issue? Queensland's talked a bit nationally over this compassionate issue, and your comment about Queensland.
No, I think we're very compassionate, Patrick. We are very, very compassionate in this state. And as Dr. Young said very clearly, if there is someone that needs emergency care, if they need, a helicopter to fly them to one of our hospitals, that will happen. If they need an ambulance to come and the clinicians decide the best place and the fastest place to go, they will not be stopped from going.
Do you regret that comment?
No, because these are really difficult decisions, and as I said, people deserve the best healthcare, and as Dr. Young said, if they can get the healthcare locally, then that is good. If it is an emergency or if we have the expertise, of course we will do that. But we are living through a global pandemic at the moment.
But drawing the dots there, it seems, and I've asked Dr. Young the same thing, it seems that this woman or her doctor did not seek to come to Queensland, they chose to stay.
Well, Lane, I don't know the specific details, but I do not get involved in individual cases. These are clinicians that make these decisions in the best interests of their patients. And this is an absolute tragedy about this young baby. I mean, there's a woman who's grieving at the moment, and many people know what that feels like. So, you know, if the clinicians make that urgent decision about where a person needs to go, or a young person, they will be made in the best interest of that young person.
Scott Morrison today called for a common set of principles in terms of the borders. Is this something we can get to?
We will continue to do whatever we do to keep Queenslanders safe. And what we have seen is that our borders are keeping Queenslanders safe.
Do you think there needs to be more of a national consistency though in the rules around?
Look, I think what there needs to be is a national consistency where we are focused on fixing up Victoria. I have said that time and time again. Why are we not throwing all of our efforts at getting Victoria under control? We've seen what's happening in aged care. That's been debated heavily at a national level down at the Parliament this week. There's community outbreaks in New South Wales, and now we are getting on top of the issues that we have here at the detention centre and the Correction Services Academy. You need to act swiftly and you need to act fast, and that's exactly what we're doing.
Schoolies, how do
Yes.
possibly patrol every apartment block of the world, tens of thousands of kids there?
Yeah, well, I think, Lane, what Dr. Young was saying, and I'm happy to say this as well, is that I don't think there necessarily needs to be a particular week that young people are going away. And what we're encouraging people to do is, and this is for Queenslanders in general, to go out and back their local providers.
But most of those kids are booked 18 months ago. They're going to go there that week.
Well, it's going to be very different. It's going to be very different. They have to register, and there has to be COVID, like the individual hotels will have their plans in place, but there are going to be no organised events, and it's not going to be the event that everyone thinks it's going to be. So I think people should reconsider, and maybe they might think about, well, you know, we won't go that week, we'll go the following week. And that way we're also supporting our tourism operators over a longer period of time.
If that's the case, we should be calling on some of those apartment block owners to do the right thing and refund.
Look, I'm quite sure they will. I'm quite sure that people know that we're in difficult circumstances at this time, and as I said, the Chief Health Officer and our Director General of Tourism will be writing to all of those providers as well. And there will be limits on the number of people that are allowed in units. There will not be mass gatherings and there will not be large parties. But I remember way back when I went, many, many years ago, we went down with a group of friends and we stayed in an apartment, and we celebrated the end of our year with our close friends. And I'm quite sure that we are definitely not stopping that. I back that we need to focus on getting Victoria and New South Wales under control, and of course we are focused here on Queensland of getting these issues under control. But we know that the border will not be open to Victoria for a long, long time until there is no community transmission, and we have set that same principle for New South Wales and ACT as well.
Just on something different.
Yes,
On the
Lydia.
copper smelters expected to be made in the next few weeks.
Correct.
We've seen the government come in and save the smelter the last 2 times.
Yes.
Will that have to
Look, we are in discussions. These are confidential discussions at the moment, but we know how many. There's a lot of workers that work there, and the Minister for Resources is having discussions with Glencore. So they're commercial discussions at the moment, but of course our priority is to keep that workforce going.
when can we expect a decision on?
When those discussions are completed.
And do you think taxpayers should pay for a feasibility study for control by power
In relation to that, I think, if the federal government wants to do a feasibility study on the coal-fired power station, they should go ahead and do it. If they want to use taxpayers' money, they can do that. That's their decision.
Does that put you at odds with your federal counterparts?
I don't think so. Well, I don't care if it does, frankly, because we in Queensland we have a very strong resources industry. And we also have a target of 50% renewable energy. So I value all of those jobs. I value those coal miners' jobs, but I also value the jobs in renewable industry. And you saw just last week we announced our plan for our renewable energy zones. And of course our resources industry is open at the moment when around the world, South America, other countries, India, shut down. So, you need metallurgical coal for steel. Yes.
You mentioned on ABC this morning there'd been a stretch on resources covering the Ipswich Hospital ED staff. How many of those staff are in quarantine at the moment?
I don't have those exact numbers. Happy to share them in general terms, but we do know that one of the confirmed cases from the Brisbane Youth Detention Centre went to the emergency department and was treated at the hospital, and therefore there are a number of staff there considered contacts who currently are unable to work, and so we have deployed doctors and nurses and other staff from other hospitals to Ipswich.
Is that like dozens?
It's around those kinds of numbers, yeah, but we'll get there.
Sorry, I think you might have flagged with you from our regions a firefighter workers exemption. There's a bit of concern about mental health for the family. A man, apparently across 7 weeks, he's doing 4 weeks quarantining in Queensland and Victoria. He works on the oil rig or something like that, straight, you might be aware. They're quite concerned for him. Why aren't you giving that sort of case an exemption in some way?
I was, except that he flies in through Tullamarine Airport, and we've had a very big outbreak at that airport. So initially I did declare that people could transit through airports if that's all they did, and that's fine still for Sydney Airport, for instance, but Tullamarine has become a risk, so we discussed it at great length at AHPPC at the... It's difficult. I feel for him. I remember that exemption. I considered it. Took me a while to work myself through it because, yes, I really do feel for him, and I hope that his employer can do some work there to sort it out so that it can be managed better than what it is. But it's purely about the risk of going through Tullamarine Airport. So there are other airports they might be able to work through. At the moment, I'm treating them as 2 separate clusters, but I suspect that we'll find they're linked because they're in the same area and a lot of the people live in the same places. So I suspect we'll find they're linked, but at this point in time, I'm treating them as 2 separate clusters. Yeah. Of course. So no different to back in June. So I met with various representatives from the boarding school community last night and talked them through it. So they've done it before. They did it extremely well. They've got all their systems in place. So any children who live in the New South Wales declared border zone can cross over into Queensland without any quarantine, and they can go above. I've given them an exemption to allow them to travel beyond the Queensland border zone. Normally you can only travel between the 2 border zones, but for those children they can go straight from when they cross the border through to the boarding school, wherever that may be, without stopping between the 2. So that's in place. Then I've also said that anyone who lives south of the boarding zone, of the border zone in New South Wales can return to Queensland. So I've given an exemption that they can continue to come to Queensland for their education because education is so important, but they will need to quarantine, but I have given them an exemption because the boarding schools have excellent COVID-safe plans that we've worked through. I've given them an exemption that they can do that quarantine in the boarding school. So they must have their own bedroom, a single-use bathroom, they get their meals in their room. So the boarding schools have done that before very effectively. They'll do that again.
All right, thank you.